Hello everyone and welcome back to another episode of our Rhinoplasty series, where I'm going to talk about revision rhinoplasty. And nose surgery doesn't always produce the desired outcome. There is always a chance that your rhinoplasty fail and you develop complications such as a breathing problem after the surgery, or that the appearance of the nose isn't what you want it to be. In any event, you need to have another nose surgery to fix the problem. In other words, you need to have a revision surgery. Revision rhinoplasty is a surgery that is intended to correct or improve the results of the previous surgery. Depending on the severity of the problem, a revision rhinoplasty might be a life and death surgery that is essential for the health and appearance of an individual, or an optional or elective surgery that people decide to have it by choice and for the sake of a more attractive nose. Revision rhinoplasty is performed in the same way as a primary rhinoplasty is done, but it requires greater expertise on the part of the surgeon. This is because in the previous surgery, the structure of the nose, that is the nasal bones and cartilage, has been altered, and this makes it more difficult for the surgeon to rearrange this structure. Also, there are layers of tissue in the nose that the surgeon easily separates in the first surgery to access the underlying structure. But after the healing, these layers become somehow indistinct and unnatural, which makes it harder to separate them in the revision surgery. The weakened nasal cartilage is also a big challenge in the revision nose surgery in many cases. It may be that too much of the cartilage is removed in the previous surgery, leading to problems like nasal passage collapse, a dropped nose tip, or a pinched nose tip. In order to correct these issues, the surgeon may need to use cartilage grafting techniques in revision rhinoplasty, which involves using healthy cartilage from other parts of the patient's body, like ear or rib, to add to the nasal structure to create a support for different parts of the nose. It goes without saying that a second rhinoplasty can also be unsuccessful or unsatisfactory, leaving the patient with no choice but to have yet another surgery. It is also obvious that the more times you get a nose job, the more complex the procedure becomes. So having a third or fourth rhinoplasty is much more difficult and risky than the first and the second ones. But can revision rhinoplasty be done immediately after you realize that you need one? Of course not. You must wait at least 1 year before having another nose surgery, because it takes that much time for the nose to completely heal, and it is very risky to operate on a nose that hasn't healed yet after a previous operation. In fact, no decent rhinoplasty surgeon would ever accept to do a revision surgery less than 1 year after the first surgery, so it's better not to insist. And finally, my advice to you would be that you be extra careful in choosing your rhinoplasty surgeon so that it becomes less likely that you would need a revision rhinoplasty at all. And that's a wrap for today's video. Please visit our website and check out our Instagram if you wish to get to know us more, or you are interested in rhinoplasty or other cosmetic surgeries. Thank you for watching us, and bye for now.